Obesity is one of the most pressing health challenges in the U.S. I think it's been for a very long time, but experts say, it's time we rethink how we approach it. A growing body of research highlights the role of genetics, biology, and even long-term care in addressing obesity today effectively. We've got Dr. Kevin Stevens, Sr., joining us this morning to discuss how we can shift this conversation. Good morning to you.
Good morning. How are you this morning?
I'm all right. How are you doing?
I'm just terrific. Thanks for asking.
Good. Always a ray of sunshine here. I think this is a really good topic.
Yeah,
Obesity in some way touches everybody's lives, even if it's not an ongoing issue you have. Maybe at some point you've dealt with it, especially here in Louisiana. So what are we now thinking about a new approach?
Well, the first thing you have to realize that obesity is a health condition. Just like diabetes, hypertension, heart disease, it's a health condition. And it's not a weakness in your personality. And we have so much stigma for people who are overweight. Well, you just eat too much. You need to push back for the, you need to walk more. You need to do it. It's not so easy. I mean, particularly after you have kids. I mean, when you have kids, your body changes, and it's more of
you don't have time to do the things you need. You're probably not getting enough sleep.
and certainly there are things that we can do to help, what you eat, how you exercise, and those kind of things. But the first thing is you got to get over the stigma, because if you don't get through the stigma, you give up. You say, well, I give up. I'm not going to do anything. It's not going to work. And
I can't.
No, you can't. Right.
Yeah. So, and we're talking about some of those other factors. Go over a couple of those, because you did kind of, we just mentioned sleep. You mentioned it might be something that's genetic, but there are a lot of things like stress or hormones, so many things that are happening under the surface we don't see.
Well, sometimes you have to figure out why is it that we have difficulties in our diet. It could be fast food. It could be we just don't have the time. It could be you can have a loss of energy. I mean, you just be tired from working 2 jobs and stressful. And sometimes the stigma can make you depressed too.
Sure.
And even if you get and seek surgery, I mean, there are bariatric surgery, there are all kinds of things that you can do. And so that's a cop-out. I mean, you take the easy way out. I mean, you just walk more. I mean, get up at 3 o'clock in the morning. I just went to bed at 2.
Right, right. No, you're absolutely right. So in looking at this research, in changing the conversation, how will that help our nation's health overall?
Well, the first thing you have to do, there are some new medications that have come out. We call them GLP-1s. We found out that we use that to treat diabetics with, and it has a so-called side effect of reducing your weight by 15 to 25%, which is incredible. And so there are other things that we have in our exercise regimen too, with the dietary, reading the labels on what you eat and looking at food, fresh food as opposed to frozen and processed and fast foods. So we have, our society is kind of triggered to microwaving it and going through fast food.
What's quick,
but even in the fast food category, there are healthier options. We should all lay away from fried foods and fatty foods and salt and those kind of things. But the other thing is that obesity is associated with other things like heart disease, liver disease, and those kind of things.
Absolutely.
So we have, it's not just one little thing, it's the whole person. So we have to rethink it. It's just not saying exercise and walk and watch what you eat, but it's how do you live?
We can all be kinder to each other, right?
Yeah, that's right.
Be kinder about this conversation.
And it's okay if you're a little overweight. I'm working on it. Okay, all right.
Tell them that I'm a work in progress.
Well, I don't have much hair, but I'm working on it. Well, I don't know how I'm working on it, but
well, we'll still support you either way.
I may be bald like our buddy here,
Hey, it's a good look. We appreciate you. We're staying on the topic of health at 8:30. Functional performance specialist Spencer Shillstone joining us with a core strength demonstration used to prepare for one of the most grueling endurance competitions in the world. But you can learn a little something too if you're a work in progress as well. That's coming up in our Wellness Wednesday segment.